And Glenn Benjamin. I'm the veterinarian for Safari West here in Santa Rosa, and the object today is to anesthetize this animal so we can do a complete hoof trim on her. She's had some serious foot problems over the past, and they've been patched and done, so today we're supposed to make her perfect again. 6cc syringe. There we go. Experimental drugs, so our experience with this in giraffes is rather limited. Blindfold towels that down there yet? We have to watch her. She may go down in about a minute.
What'll happen? She'll just
probably slide down.
Yeah.
This is Dr. Kaufman. This is Peter.
We're anesthetizing this giraffe to trim its feet today. There are inherent risks in anesthetizing a wild animal, especially a giraffe, due to their conformation, their anatomy, their cardiovascular system. However, this hoof wall is growing out so fast on the hoof that we need to image it from the side to make sure that we're not getting too close to the third phalanx when we trim this foot.
Jamala with a J.
You got a birth date? I'm using the Equine digital x-ray system. I've had it in my equine practice since '04. We're going to image the foot of the giraffe from the side in order to see how much hoof wall to actually remove so we don't get too close to the third phalanx of the foot.
So there's your coffin bone.
Yep.
And there's your coffin bone. Or you know, there's one toe.
This is the long one here.
Yeah, this is all your hoof wall.
We'll do the left, yeah.
Okay.
You can let it out just a little bit, Peter. How does that work for you?
Wonderful.
While the giraffe is being monitored by the group, digital x-ray is allowing us to monitor the trimming process before, during, and after trimming, so we can assess the hoof wall in regards to the amount to be removed in regards to the third phalanx.
Take as much as you can and maybe a titch more. Pucker a little bit.
What does that look like for dorsal surface and ground? Pretty normal?
On the left front?
No, on this one.
We're going to do a post-trim
Nice white line there.
radiograph and make sure everything's okay.
I think we should take a little bit
Take
more
more
off
off
the
if we
toe
need
here.
to.
Well,
Looks very nice. Very good trim here. Okay.
Yep.
Check it out. That's wonderful. See how the dorsal wall is aligned? This looks really, really good.
Yep.
It was a team effort between veterinarians, farriers, wildlife experts, and Safari West to ensure that the giraffe was not down longer under anesthesia than necessary.
So once we get to an hour, let us know who's ever...
An hour down or an hour since the first
Hour
time?
down.
So you're reversing?
Not quite yet.
We got a position.
You want me out of the way?
Yeah.
Are you done?
We're done.
Okay.
I'd like to get her headed around a little more that way, but we got to get everything out of the way
Pull
first.
her butt that way then.
hey Glenn, when you reverse her, let me know, because I want to shut this door.
Right. What we're looking at here is the history of all the other ones we've done with this drug and with carfentanil, which is a related drug. This is an experimental drug, so our experience with this in giraffes is rather limited, but somebody has to do it for the first time or two. And we're sort of fortunate that we've been chosen because this drug seems to be much more effective, works smoother, with less side effects than the traditional carfentanil.
Everybody get in here and push as much as you can. Keep going. Lift. Hold.
Atta girl.
Let's just see. Okay, let's
Back there.
good job. Great.
Sorry.
She should be able to, yeah.
Good girl.
Up there.
Good, you got it, good girl.
Let go of that, yeah.
Yes.
Good. Atta girl.
Pull the strap off. Good job.
We hired Dr. Kaufman here to come out and help us today because he has the late state-of-the-art visual imagery, and we could then determine exactly where the coffin or P3 bone was in relationship to the hoof wall. And therefore we could cut it exactly as it needed to be, not have to, as the old farrier used to tell me, you cut and cut and cut until you see blood and then you back up 2 strokes. And this way we can do it the right way. Thank you.
And with state-of-the-art digital imaging, we see right on site what we need to do, where we need to go. We did pre and post trimming radiographs, so and we could monitor it through the trimming process, so that indeed you don't take too much and get down to sensitive tissue. And so it's the only way to go, especially with a giraffe. I mean.
Oh yes, you don't want to do this every day, as you can see from how difficult it was.
Yeah, just with the anesthesia.